And now it is my great honour to welcome Dr. Michael Ryan, whose global leadership and insights remind us that challenges we face locally are part of a wider human question, and that courage, compassion, and evidence based actions are the best answers we have. Dr. Ryan.
But it's a great honor for me to be with you today. The staff that are here, the volunteers, to the guests, the funders, media colleagues, President Higgins and Sabina, First Lady, welcome as well. It's a great honor actually for me to stand here in the Druid, McLelly's Druid Theatre. I remember being up there in 1982 helping Spud Murphy put up some lights. So it's kind of it's a return to form. In that sense, the journey of this organization over 60 years in Galway, you think of things like the Druid, you think of COPE, or you think of the things that are pure Galway, and it's part of that vernacular of Galway. 60 years ago, the organization began with a simple but powerful idea, people within the community, that no one should face hardship and vulnerability alone. And from those early beginnings, what started as small acts of care has grown into a pillar, and you heard it, a pillar of trusted support and services for countless people in this community. But it's not simply a charity. As the commemorative booklet said, and Michael said as well, it's really become a professional social care organization focused on inclusive dialogue, on evidence-informed practice, on innovation, on excellence and positive change. And I say that word excellence because sometimes in the public service, the community service, sometimes those out there in other services see us as the bleeding hearts. We kind of, whatever best effort is good enough. We're just help it out. It's a charity. It's not acceptable. Public service and community service has to be based on excellence. We have to deliver more with less all the time. Doesn't matter whether you're in Galway, doesn't matter if you're in Ireland, doesn't matter if you're in Europe or in the world. And I think what Michael has laid out as the future is really where public service needs to go in the future. And as he said, COPE Galway's vision is steadfast now, a community where every person is valued and supported at every stage of life. Over the decades, as you've heard, this organization has stood beside people in some of the most difficult moments of their lives. We've all been there in our own individual lives. And it's that solidarity of the moment when you feel most vulnerable, most alone, most exposed. It's the person that stands with you, is the person you will stand with afterwards. And involving clients in that process is so important. It has evolved as the communities themselves have changed. We're not been a perfect society. We're a society who hid away abused women. They had to hide from not only the perpetrators, but from the very community that judged them, not as a victim. We had to endure a society where being old was being used up. You were a problem. Uh, and we were a society we saw homelessness in the same vein as laziness or the inability to cope. Homelessness was a result of your lack of effort or your lack of worth. So we're not a perfect society, but we have evolved as a society. And we have evolved, and COPE has evolved, offering refuge and respect to those experiencing homelessness, safety and dignity to those experiencing domestic abuse, healthy nutrition, care, and connection for older members of our community. These aren't just services delivered to a contract. They're lifelines provided to people when they are most vulnerable. They show often desperate people a human face, a human embrace, enhancing their inherent dignity and offering them a path to a safer and more hopeful future. Behind every statistic is a person. So many people said that. You said it. A person who found warmth on a cold night, a person who discovered safety after fear, an older neighbor who realized they weren't forgotten. And behind every one of those moments is this organization, the community that supports it, and the agencies who fund it, all the remarkable people who've made this journey possible over the years. When I lecture students embarking on their masters in public health, I often use one slide at the beginning. And the slide has just 3 symbols on it. It says N equals 1. Because these people are about to embark on counting individuals and counting study groups and observations. We epidemiologists like to count things. And we're great at summarizing the human condition in tables and graphs and maps, representing hundreds, thousands, millions, even billions of people. And I tell my students that they'll be bombarded by such population summaries, by cold statistics, all very useful and important when you're looking at a problem. But I tell them not to forget that the most important number is 1. N equals 1. Because all the ones matter. You engage with one person and help one person. Then you help another person, then another. And before you know it, you're helping and transforming the lives of so many. And the COPE hasn't forgotten that the ones matter. So to COPE, its staff of volunteers, your professionalism, your empathy, your resilience inspire us all. And I've only been involved with COPE a few years during COVID. At Colette manhandled, wrangled me into supporting COPE, and I've tried to be as supportive as I can since. To the volunteers, and I know all the staff have mentioned this, to the volunteers of COPE, your generosity of time and spirit and skill involves the very best of community. I think, Michael, you outlined in the forward to the commemorative booklet the spirit of Mehel, the spirit that the community comes together to help others. It's a very important concept, I think, in Irish culture and society. And if hope is a constant, ongoing, 24-hour, 365 Mehel, and the volunteers make that happen. To the supporters and partners of COPE, you've believed in its mission for so long and you've helped it grow stronger year after year. I think the greatest testament to this organization's impact, and it's been mentioned before, is the concept of dignity. Dignity is a very important concept in public service. I was watching a documentary a couple of weeks ago about the Irish famine, and it wasn't the hunger that was a poet. I can't remember the person's name, but he said it wasn't the hunger that affected them. It was the very indignity of not having food. So someone is starving to death. It's the dignity or the indignity of that situation. So I think that's the greatest hope. It reminds people all over Galway that they matter, that they belong, that hope is always possible. And we've all been there in our lives when you were mentioning the fact that sometimes it's hard to hope. It's hard because it's you don't have enough money, you don't have the resources. So many people are going without services. I think you mentioned 120 families been supported by one worker. That's shocking. But at the same time, when you have that loss of hope, and I've done this many times in the field, and you're overwhelmed, but you look around and you see people helping themselves, and you see your co-workers getting out of bed again, doing it again, and that's what gives you your hope back. Is the fact that others keep going when sometimes you feel you can't. And it's that collective spirit, that mehel, that makes it all worthwhile. This has been my own personal experience working in many, many countries, very often during major epidemics, disasters, and wars. It's organizations within and serving communities that are the most resilient, the most adaptable, the most innovative, and the most effective. They unlock the power of community. They ensure that interventions are co-designed, acceptable, and accepted. They recognize that traumatized people and communities need safety, solidarity, and dignity, not pity or charity. That is the same no matter where you are in the world. You can bring all the resources from outside in and all the expertise in the world into a situation. But if you do not understand and respect the views and aspirations of a community, if you do not involve them in the process, if you do not engage them in the delivery and the evaluation, you will fail. You will fail. I've seen it too many times. At times on the ground, I've come under pressure from people to push forward quickly. It's an emergency, for God's sake, let's move. But there's a critical moment in any enterprise, especially a public service, where you need to slow down and listen. It's like slowing down for a bend in the road. If your enthusiasm and often your own arrogance, you can accelerate and apply pressure to the pedal at the wrong time, and you lose that bend and crash. If, however, you take a beat and you slow down a little to bring the community on board with you, you can take the bend and accelerate away with that community towards success. It's so important. It's because we're all trained to get out there and do it. But if you don't stop and listen, then you're going to fail. Governments and donors do recognize that. And in Ireland, there's widespread funding of community-based organizations, which I think is a wonderful thing. I think it recognizes that delivering services through community organizations can be hugely impactful, very cost effective, very often a better way of delivering services. But we also need to be careful here. It should not be seen as the easy or cheaper option. It's not about offloading accountability to others without the needed or adequate resources to do the job, in the knowledge that the volunteers and the staff will make up the gap in effort, make up the gap in time, and make up the gap in delivery. It is about harnessing the power, the ingenuity, and the energy of communities with the resources needed to do that job. Public procurement, community delivery. Governments are accountable to provide the resources, but delivering those services through community-based organizations, in my view, is a hugely effective way of doing that. But as you said, Michael, that has to be based on excellence and learning and innovation, not just best effort. And community organizations need to adapt to that new sort of demand as well. I know how much, talking to people at COPE, just how much they appreciate the funding they receive, and even more the work with the volunteers. But in truth, I believe we need more investment as the needs continue to grow, as was outlined by the panel. And there's a need for more social and support workers. Sinead, I think you said it, we simply must address the issue of child homelessness. It's shocking to me in a country that's as wealthy as we say we are, that that's not being addressed. And we have to support organizations that are targeting child poverty, support and welfare. Gillian, as you said, we need to hold perpetrators accountable and not have victims hiding away as if they have done something wrong. So there needs to be shifts. It's not there yet. We're not perfect yet. There have to be shifts in the way we deliver care. But for 60 years, this organization has adapted to all these new challenges and changing needs. That one thing hasn't changed. Its unwavering commitment to human dignity, compassion, and community solidarity. And as we celebrate this anniversary, we're not just honoring the past, we're looking to the future, as Michael outlined, because the work isn't finished. The need for compassion, advocacy, and support remains as urgent as ever. But if the past 60 years have shown us anything, it's that when people come together with purpose and with kindness, real change and progress is possible. However, as I said before, we need those expanded services. We need to put more focus on prevention. We need to put more focus on learning and innovation. We must also reaffirm our commitment not to leave people to their fate, to change their destinies. Promises need plans. So many plans. Plans need planning. They need resources. They need implementation. They need execution. They need monitoring. And most of all, they need accountability. I can tell you in my career in international health, I've seen more plans become doorstops because there isn't the will or the resources or the accountability to get the job done. We're being bombarded right now with populist views about people, people's worth, people's value, judgments about who people are as homeless people or victims of domestic abuse or older persons. We're in a cruel phase in the public discourse in our society. We've been duped into blaming people outside or on the margins of society for our woes. Ireland must not do that. We must not be fooled or threatened by those who would threaten and manipulate us. We should not become members of the Something Must Be Done club or it's not my job to do it club. We have to become members of I'm doing something about this club. We're now a diverse, I hope we are, or more diverse and inclusive society, seized of the values that are, I hope, truly Irish. Those of inclusion, tolerance, an overarching desire to help those that are vulnerable. A country that is not only prosperous financially, but it's rich culturally, socially inclusive, environmentally sustainable. A country where all our children can thrive, be happy, and grow. An Ireland we can be proud of. As Ireland understands, I hope, that our greatest resource is our people, not our finances, and we will not leave a single one of those people behind. In that regard, I do recognize the presence of two of my heroes, Michael T and Savina. and you've been spoken about many, many times. I know, Sabina, you're a patron. Michael D, you wrote the forward for the commemorative booklet, and you've been huge supporters of COPE throughout its journey. It's a great honor for me to be able to speak in your presence, I must say, and I'm honored to do that. And I know how excited everyone is to have you here today. And you represent, I think, two people who've dedicated their lives to equality, to inclusion, to community, and to social justice. And as an Irish person who lived abroad for many years, I can tell you, nobody knows the Taoiseach, nobody knows the Taoiseach, nobody knows who any of those people are, right? They all know Michael D. Higgins, right? And it was a huge source of pride for the Irish diaspora, for the hundreds of thousands, possibly millions of us who were abroad, that we had a president that was so respected internationally, seen as a truly kind and principled person whose values were so centered on human rights and human dignity, and a poet to boot. So, so it was a source of great pride for us all. So thank you both, and welcome home back to Galway belatedly. So today we celebrate a legacy built by generations before us, built by the staff, built by the community, built by the volunteers. As you said, Michael, built is a very important word. It didn't happen by accident. May the next 60 years continue to bring hope where there's hardship, safety where there's fear, and connection where there's loneliness. Congrats to you all on this remarkable anniversary, and thank you for everything you've done and will continue to do for and with our community. Happy 6th anniversary. Thank you.